Okay, Nessa, female of 4 years old. She came in with hotness of skin hot, fever, skin hot with cough. For her, she had a body temp of 37.9 degrees Celsius, which tells me that she might have malaria. I will do a malaria kit test. I put a dropper down, 3 drops, and I wait for the result for 15 minutes.
Malaria becoming endemic in the area due to climate change, and though the place is cold, we have some due to climate change, malaria is becoming endemic. Malaria has several different types of the parasites that cause malaria, but there's 2 that is very dangerous, which is Plasmodium falciparum and Plasmodium vivax, which the severe condition where malaria we can have is we don't want to have a cerebral malaria. You don't want to go to the stage where you have cerebral malaria, which it can be life-threatening.
I think the teaching is actually a really important aspect because that helps prevent disease, especially here where even with the A post, treatment can be in short supply, or accessing treatment that, from the hospital is very difficult. Then it's really important to try and educate them on how we can prevent them getting sick in the first place.
Basically, malaria is one of these killer diseases, the #1 killer disease in PNG. And for that reason, we are trying to do better distribution all throughout the country. That is to reduce malaria incidence. So I think the most important thing is you must use your nets. That people have to use their nets every night. And that's the only way to prevent you getting malaria.
It is important that we understand how we get malaria and what treatment, how we diagnose and what treatment we should get. So the symptoms that will present with this is you have chills and rigors and fever, joint pains associated with. And in order to diagnose it, we have this malaria RDT kit to diagnose malaria.
There's 2 types of positive. It's PEN and PF. For this patient, male, Juby, male of 26 years old, he presented himself with skin cold and multiple joint ache with watery stool, which is the typical signs of malaria. To confirm that it's malaria, I did a test for the malaria, and it gives me positive Plasmodium falciparum. So I will treat him as a malaria positive. I will give him a treatment for malaria, which is Mala 1, or can check him blood din. Primakin baik sim stedos tu. Primakin stedos, now baik sim stedos primakin. Okay
I think it would be impossible for them to be here without MAF because the airstrip and MAF are their lifeline. It's their lifeline for food and supplies, it's their lifeline for medicine, it's their lifeline for patients too, needing to be flown out. So I think it would be unlikely that health workers would be willing to come out here if there wasn't the support with MAF. But then also it might be impossible to be running this health centre without the support of MAF.